Welcome back to another episode of Spilling the Tea with Dr. Hendrix.
Hey, that's me. Dr. Tyler Hendrix is here. We also got Gabriel D.
And your favorite, Lava Lee.
Lovely. The trio is back. Today, we're going to be talking about a question that you actually submitted in the comments below, asking whether or not it's necessary to have a high sex drive. This is really interesting because we talk about sex drive a lot here, but are there biological functions that are necessary regarding having a higher sex drive? Are you at a bad position if your sex drive is low? So what do you think? Is this something that you've thought about or have any questions
Definitely.
about?
We're always talking about sex drive here in this channel, and we don't talk about the importance of sex drive. Is
Right.
it important? Is it necessary? We're going to dive in. Again, I have a few questions for you, and I'm excited.
So before diving in, the most important thing to understand is that everyone has a different sex drive. Everyone's sex drive is also going to fluctuate throughout their lifetime, depending on their age, their hormone levels, and it needs to be associated with their quality of life. It needs to be associated with what their wants and needs are. Not everyone is going to have a high demand for sex. And that's completely normal and nothing to be concerned about.
Everyone is different.
Exactly. And a diminished sex drive, of course, is important enough to where you may have concerns, want to talk to a medical professional about it, especially if sex is an important part of your life, if that's where you get a lot of pleasure from, if it's an important bonding experience with you and your partner. So if you're seeing those changes or a decrease in your sex drive and it's bothersome or affecting your quality of life, that's when it becomes a problem.
Right.
And the most common potential cause of a decrease in our sex drive is, of course, going to be our testosterone or hormone values. And if you're looking to increase or improve your sex drive, this could be a sign you have low testosterone. If you're not sure how to get started getting screened for low testosterone, you can reach out to us here at hendrxhealth. There will be a link in the description of this video where we can screen you for low testosterone, as well as a bunch of other essential biomarkers to ensure that your symptoms are related to low T, and if so, get you treated appropriately. We are running a special right now where it's $150 for a full panel review of all of the important hormones and biomarkers that could be contributing to those symptoms. And of course, we get to review all those results together. Again, that link will be in the description of this video. If you'd like to make an appointment with me, would love to meet you.
And why not check your labs? Check everything's all right, if you're healthy.
Yeah, we do a pretty comprehensive assessment. Again, we're going to look at your thyroid hormones, your cholesterol values, your blood counts, your kidney liver function, all your electrolytes. We check your vitamin D and B12. So a really thorough assessment, of course, all those important hormones as well, estrogen, free and total testosterone. So a great time for me to answer any of those questions you have, and a great way for me to meet patients out there that, may have some questions for me.
Can I check my labs too?
We always check your labs. That's one of the benefits of having me around, is we get to be on top of that stuff.
I agree, that's true.
But now that people out there know how to get their testosterone screened, if they don't have a primary doctor or doctor who can do that for them, let's dive into some of these important questions you have for me.
As always, we're going to start with the basics. What is sex drive?
We've talked about it before, but sex drive or libido is that primary force that kind of pushes us towards sexual activity, gives us a sexual appetite, makes us feel horny, if that's a phrase you like to use. And so it is important for a lot of us that find sex to be an important part of our lifestyle, or a part of our relationship, or a part of how we conduct our day-to-day activities. For those of us that don't put sex as a priority, of course, that sex drive may be lower. And things that are going to influence this, of course, hormones is number one, genetics, some environmental factors like stress, how much you're exercising, what you're eating, all those things will come into play and to sort of support and establish a healthy sex drive.
And age, I assume.
Yes, age. So that kind of goes in with the hormones, because really age is tightly associated with hormones. Of course, you can think of complex medical conditions that also happen to us as we age if we're not taking care of ourselves. And so those things can certainly impact our sex drive. But really the most important with how age is progressing is going to be those hormones.
Everything's connected, correlated, as always.
Yeah, and so what's interesting is clinical data is now showing that 20% of men in their early 20s can have low testosterone, 30% of men in their 30s, 40% in their 40s, and it kind of continues. So it's really increasing as well. This is new data in comparison to years ago, and there's many different reasons why this could be happening. But the most important thing is if patients have concerns and it's affecting their life, we get them treated and get them feeling better.
It's so interesting that 20% of patients are with low testosterone. You think low testosterone is something that only happened with older men.
Yeah, exactly. That's exactly what happened to me when I was diagnosed in my 20s. Definitely did not expect that to be my journey, but brought me to where we are today.
And so how does testosterone impact sex drive?
Right. So that is a very powerful hormone that's going to act on receptors in the brain, the specific areas that are responsible for our sex drive. But it's also really important with our sexual function. So it's going to interact with our genitalia, the blood vessels that dilate and constrict when we need to have an erection. It's also going to be one of the main forces that ensure you have a strong and long-lasting erection. So all those things based on the fact that the hormone is just acting on a receptor. So it's kind of crazy when you think about these chemical signals that really do control our day-to-day activities.
Yes.
And so monitoring and managing those hormones has become really important, especially now that we're seeing such drastic changes in our hormone levels over time.
Is having a low sex drive a serious problem?
That is a really great question. It's going to depend on who you are. So if sex is not important to you, of course, that's not going to be an issue, but you do need to realize that having a low sex drive could be a symptom of something else. So yes, low testosterone, improving it is going to impact your sex drive, but there's a lot of other factors that low testosterone can be causing. Clinical evidence has now shown that if your testosterone remains low over time, it puts you at an increased risk of high blood pressure, cardiovascular disease, anxiety and depression, and many other concerns. And so it's not just fixing the testosterone to improve your sex drive, but if that's the only concern you have and you get screened and your testosterone's fine, this could just be your personal preference. There could be something else going on. But in general, there's no major health deficit or problem with not having a high or healthy sex drive. That's just patient or person preference.
And so when is testosterone the main cause of a low sex drive?
That's a great question. So some things that can be helpful in determining what's the cause of your low sex drive is if you have any other symptoms. Typically, low testosterone is going to also present with fatigue or feeling tired that doesn't improve with rest, even if it's copious amounts of rest. If you notice an increase in body fat, a difficult time increasing your lean muscle mass, if you're feeling more anxious than usual, and then of course the most pronounced sort of effects would be feeling less motivated, having trouble concentrating, feeling more irritable. So all of those symptoms in combination with having a low sex drive really does pinpoint you to the fact that there could be a hormone problem going on. That being said, some patients only have a low sex drive. Everything else is going fine
Wow.
and they still have low testosterone. So it is important that you talk about your individual experience with your doctor or with us at hendrxhealth. Happy to discuss those issues with you to see if low testosterone is that issue and get it fixed so you can feel better.
It's interesting how something so simple as TRT can help and improve symptoms of low sex drive.
Yeah, and what's interesting is that it's usually one of the first symptoms that improve. Typically, in about 2 to 6 weeks,
Wow.
patients notice that increased sex drive, which of course is also reassurance that their treatment is working
Yes.
for them. And also, TRT used to be pretty strenuous in the past. You'd have to go to multiple doctor's visits, get multiple lab tests. You'd inject using a large intramuscular
Yes.
needle once or twice a week. And so it was a much more painful process, in my opinion. Now it can be so smooth as you can see a doctor over telehealth, be prescribed and have a medication sent to your door. We use a subcutaneous needle, so the needle is extremely small and virtually pain-free. So of course, what we do at hendrxhealth, we try to streamline it as best as possible. So it's really nice for me to get that positive feedback from our patients and just make it a little bit less stressful because any type of medical condition is going to be a lot to handle, especially at the beginning.
I feel like there's also a stigma around TRT and people were not seeking treatment because there's always this image of TRT related to steroids.
So there's all of that and many myths and things that bring hesitation to people. But that's why I love that patients can make an appointment with me. We can screen their labs, talk about their issues, and I can address a lot of those concerns for them at the beginning.
And get men feeling healthy and better.
Yeah, I mean, that's why I became a doctor, right? I went into primary care and it was a lot of, treating chronic medical conditions where patients just weren't getting better and I wasn't seeing positive responses. And it's not all about that. That's not all I need, but it is reassuring,
Right.
when you're a doctor to see patients improve. And so being in this realm of hormone optimization, so many patients feel so much better that it makes my job in life so much more positive
Yes.
as a physician.
And not only that, you're also the patient. You're the
Yes,
patient and the
yes.
doctor, so you can
Exactly.
tell your experience to your patients and
Exactly.
they can relate to you.
Yeah, definitely makes it really the dream job.
Yes, you're a superhero.
Yeah. Something like that.
tylerjh saving lives.
Hey, something like that.
And so how does testosterone screening work?
Right. So we are going to initially meet, talk about your symptoms. If you have concerns that align with low testosterone, we'll order those labs for you. We do a pretty comprehensive assessment working with our national lab partner, LabCorp. So if there's a LabCorp near you, we can see you as a patient. And we do, again, a comprehensive assessment looking at all your blood counts, looking at your kidney and liver function, electrolytes, your prostate health, your cholesterol. We look at your thyroid health, all your important vitamins. And typically those results will come back in about 1 to 3 days. So really quick turnaround time. We'd meet over video to review those labs again. If you're an appropriate candidate, go ahead and get you started. The medication gets mailed out to you. And so really, again, trying to make it
Wow.
as streamlined and as easy as possible for patients because we all have so much going on. And typically if you have low T, you're already trying to manage your time to
Right.
the best of your ability. So again, just trying to make it as easy as possible for patients to get adequate treatment to get them back on track.
And the beauty of telemedicine, you can treat people all over the country.
Exactly. And it's cool because for me, I want to build a community where patients are like me. And so where I live, there's doesn't seem to be a large population of people that I say, we have a lot in
Right.
common. And because I can see patients all over the country and I get to sort of present myself over social media, more people who are like me typically want to, work together. And so I get to make friends in the process
Yes.
too, which when you're a primary doctor, that's what you want is to build relationships with people. So it's been a lot of fun.
And so, what other factors can contribute to a low sex drive?
Yes, of course, hormones are number one, but other things, stress is going to be a major one,
Mm,
especially if you're having conflict in your relationship. Of course, that is going to be a major cause for you to not be as sexually interested in that person. Other things like even diet, environmental factors can contribute, especially if you are obese or having chronic medical conditions that impact not only your testosterone values, but your blood flow, because blood flow is very important for our sex drive as well as our erections and our sexual genitalia to be able to function. So those are the main things. But really, again, hormones is going to be probably the number one cause
wow.
for changes in our sex drive.
Interesting how having low testosterone can make you more stressed.
Yes, and more irritable too. There's this myth that if you have high testosterone, you're more aggressive and
Yes.
irritable. That's true if you have dramatically
Mm-hmm.
high levels that are outside of laboratory screening reach. But in general, when you have an optimal normal testosterone value, you're going to be less irritable, less agitated, more focused, and more motivated. So a lot of myths there that make my job a little bit difficult, but also gives me great amounts of content to
Right.
discuss with patients. And I kind of always have those questions in the back of my head because I repeat them so often.
I feel like this is medicine in general. We always learn new things.
Yeah, you're kind of a student forever when
Yes.
you come into this career, which is what kind of led me there in the beginning. I love to learn and love to teach. So here we are.
Other than improving low sex drive, what are the other benefits of optimizing low testosterone?
So clinical evidence has shown that if you have low testosterone values, especially over a prolonged period of time, it's going to increase your risk of developing cardiovascular disease, diabetes, obesity. So being able to target that early on is going to help you to reduce your risk of developing these diseases. And of course, you may not have a low sex drive now, or you may not have trouble with erections now, but those chronic medical conditions over time will ultimately result in a low libido and poor erection. So being able to target and treat those things early on is going to be the most important way to reduce the risk of health issues as we get older.
So the earlier you address those concerns, the better.
Yeah, so the earlier you detect low testosterone and have it treated, the better you're going to be, of course, in the long run. Chronic medical conditions over time can be pretty disastrous depending on who you are and your individual health history. If you have symptoms of low sex drive, you're concerned about it, you've noticed an abrupt change, talk to your doctor, get screened to see if this issue could be easily fixed so it doesn't snowball into
Yeah.
something larger. And of course, if you don't have a doctor out there, I'm happy to meet with you to discuss those concerns, get some labs ordered, and of course, meet again to follow up and review them together. If you're an appropriate candidate, we'll get you treated and get you feeling better. So I am so glad we got to talk
Yeah.
about this. Of course, it's a short topic, but I really wanted to address it because again, it was left in the comments below. I really appreciate when you all leave those comments and questions for us. They make our
Yes.
job a lot more fun. And it's a great opportunity for us to connect with you about issues that are bothering you.
Please keep sending us recommendations. We love to hear from you. We're always looking in the comments to see if there's any topic that we haven't talked about it. And please, if you haven't subscribed yet, subscribe, like, share, drop a pen.
All those things. Join the family. We are so happy we get to meet with you once a week and discuss these health related issues. So until next week,
We don't know what we're talking about yet, but
I'm sure it'll be about sex, health, men's problems, something along those lines. So again, leave us some stuff to talk about below, and I look forward to meeting with y'all next week. See you then.
see you. Bye.
You know what today is? Peanut butter day.
Yes, we ran out of peanut butter.
Cannot happen. No. It's actually fun because when we run out of peanut butter, we get to put new peanuts in.
Yeah.
Usually we use the same peanuts.
But every peanut tastes different.
Every peanut tastes different.
Some are salty, some are not.
I think we go through way too much peanut butter though, but it is a healthy, great snack.
Absolutely.
Healthy fats, lots of protein.
It's just peanuts.